Last year, Massachusetts saw an 8% decrease in opioid overdose deaths after 2 years of increases. Despite that drop, death rates among African Americans and Latinos increased. And it's tough to tell if addiction rates have improved. I spoke with opioid expert Dr. Robert Roose of Mercy Medical Center to learn more.
At this stage in the game, it certainly is a positive sign that many of the interventions and initiatives that got put into place as a result of the working group a few years ago have started to make some positive impact. With opiate addiction and with any substance use disorders, this is a very complex problem that has multiple facets. I think in the day-to-day work, we see successes every day, and we see challenges and barriers at times every day. And in the sort of policy work that addresses it, I think we expect that there are going to be some successes and there are going to be some setbacks and challenges. As virtually every other state and the entire United States has continued to see an increase in opioid overdose deaths, this is certainly something that I think speaks to the work that's happened here in the Commonwealth to now see some early signs of progress in relationship to this crisis.
And with that progress that we saw, we also saw some unfortunate information. The rates of death in the African American and Latino communities actually rose while we saw that statewide number go down. Any indication as to why those populations, those communities, are still being disproportionately affected?
Well, one of the things that we know is that there are certain communities that are at a much higher risk of dying of an opiate overdose than others. And one of the strengths of the work that has been ongoing is the utilization of data. And so as we begin to gather more data around which groups are at risk, for example, communities of color, communities of individuals that have just been recently incarcerated, for individuals living with severe mental illness, as well as women who are pregnant or recently postpartum, we know that they are at an increased risk of dying of an opiate overdose. And so the work now is to continue to ensure that our interventions and our treatments reach everybody in all situations and are tailored to those that might be at most risk at certain times.
And what's the most likely way to get that work done? Is it at the community level, making sure that maybe area health centers or drop-in centers have information, or what should people in the community be on the lookout for, or conversations they should be having?
Yeah, so that's a great, important question, because this is a community problem, and it's going to take solutions, and it's going to take the work of all of us as community members, as medical providers, as other public officials working together to solve this. So there are interventions that can take place from a policy level that can make big impacts on this, but there are also community level interventions in the form of providing access to Naloxone, providing engagement with individuals and families in need to provide support and pathways to care or to treatment. And so it has to happen at multiple levels for it to be successful. And what's been encouraging is that I think at this time in our history, and certainly here in our community, people are engaged. People are really interested and hungry to help address this issue. And so it's inspiring and really presents an opportunity for us to hopefully continue to bring forward some great change.
You mentioned Naloxone. Is that interchangeable with Narcan? It's a preventative medicine given to someone experiencing an overdose, right?
Yeah.
So with those medicines being administered to people, I think some of the criticism we're hearing, especially since we've seen a decrease in the number of opioid deaths in the last year, is that fewer people the same number of people are addicted, just fewer people are dying. Is there any indication if addiction rates are getting any better?
Actually, no. The addiction rates seem to continue to increase, both in this state as well as throughout the United States. And so that's one of the cautions with this data around, or the results of the success
so we're
around.
Championing, great, fewer people have passed
Absolutely.
away,
and
but still people are sick.
That's first and foremost, absolutely. We want to prevent people from dying, but we have a huge crisis that's going to go on for decades, really generations. And so we know that Naloxone is a very effective intervention to save people's lives, but we also need to make sure that we are continuing to focus our efforts on prevention, on intervening in other ways, and providing treatment for the long term of what we know is a chronic disease.
Something else that really jumped out to me looking at these statistics, the rates of young people who are dying. So ages 15 to 24, 100 people died, and ages 25 to 34, about 465 people died. How does this compare with other epidemics? Do we always see these rates among young people?
No. Opiate addiction and this epidemic in particular has been particularly striking because it's impacted young people and it's impacted young people with families. Whereas if we looked at all of the individuals that died within a given year in the Commonwealth of Massachusetts, for example, by and large, the majority of them would be older age, over 65, the vast majority. But when we look specifically at deaths related to opioids, the majority, as you mentioned, are under 45, and many are in their 20s and 30s. With other epidemics, whether that be the flu or some other infectious disease, it can have a different age sort of disparity or discrepancy or pattern based on what that illness is. So it's not that all epidemics affect only young people. It just is that this epidemic in particular has disproportionately impacted young people.
You spoke a moment ago about policy and looking at that. A few years ago, you worked on the governor's task force that looked at this opioid epidemic issue. A report was issued. And now, where are we with that report? Oftentimes, people will say, a report is created, and now the report will sit on the shelf. What's your interpretation of what's going on with the report?
There's been very active engagement. As many people know, this work happened in early 2016 with many members all throughout the Commonwealth coming together to really dive deep, look at data, and establish a series of 65 recommendations. Every year, the working group and Secretary Sutters and her work group and staff and Commissioner Burrell and her staff and Governor Baker and his administration have issued a report of where we are, and to date, more than 93% of those recommendations have either been implemented or in process of being implemented.
Are you pleased with the way they've been implemented?
I would say yes, by and large. The intent as well as the details of those recommendations have borne out to be something that has been carried out. And I think we've started to see the positive effects of really creating a culture where we address this in a multifaceted way that looks at preventing, it looks at increasing access to treatment, and really understands the value that recovery brings to people and to our communities, and so supporting people as they enter and continue that process of recovery.
And we've seen that Governor Baker has actually been tapped by President Trump to give perspective from the Massachusetts experience at the federal level. Does that, do you think, have any positive effect back here in the state, or is it just it's helping at the federal level overall?
Well, I think it speaks volumes to the work that happens here in the Commonwealth. We have a wealth of experience throughout all of our state around addressing addiction. Governor Baker has stood out as a governor who has led this issue and led his other governors with this issue. The plan that was issued by the working group and has been implemented has been adopted by dozens of other states. And I think that speaks loudly to the real solidness and the framework that we think can hopefully start to turn this tide, stem the tide or bend this trend throughout the entire country.